Today we are with Dr. Lynn Pearson, and he is a medical doctor. He's an orthopedic surgeon, and he's agreed to do an interview with us. So, Dr. Pearson, where did you go to medical school at?
Went to the California College of Medicine, Los Angeles.
Okay. And when did you graduate?
Graduated medical school in 1963. Then I did a rotating internship. Then I did a 4-year orthopedic surgery residency.
Okay. And how long have you been practicing, or when did you start practicing orthopedic?
I entered my residency in 1965 and finished it in 1968, and I've done nothing but orthopedics surgery since.
So for 41 years?
Yes.
41 years, okay. Now, what is the most common type of injury that you see?
Most common type of injury in private practice is literally usually the kids falling out of trees, trampolines, four-wheeler accidents, and there's forearm injuries.
Okay, if you're forearm right here.
Forearm from the elbow to the wrist.
Okay, now, what is say we have a child that has a broken arm, and it's going to be, I guess it's going to be pretty clear because the arm's going to be bent.
Right, it'll be crooked.
Be crooked, okay. What is the first thing parents should do with a broken forearm?
Ideally splint it with whatever's available. You can use a newspaper, a magazine, or just wrap it in a pillow, like a bed pillow.
Okay.
Something to pad the arm to keep it from moving.
Okay, pillow. That's the first time I've heard of using a pillow.
Yeah, pillow is safe, easy, handy. It's in all homes. It doesn't apply any pressure. You don't need any special skills, but above all, it is patient friendly. It's safe.
It's safe. Okay. Okay. Well, do you recommend putting a pillow around it, then like using some string or cord?
Right. Just fold the pillow over the arm, put a belt around it,
Okay.
string, whatever you have. Second most common injuries is slip and falls in the kitchen and bathroom. And in those cases, the patient is usually falling, hitting an object, toilet, tub, kitchen sink, kitchen cabinets, and that usually involves injuries up around the humerus, the upper arm, shoulder, and sometimes the hip if they're on a flat floor.
Okay. And what would be the first aid? What would be the first thing that you would want to do if you think that somebody has broken their arm, their humerus? What would be the
first thing is to make sure they keep it at their side, help them up, and then get them to the hospital.
Okay.
If they're on the floor and they can't get up, call an ambulance, get somebody with a stretcher type device so they can pick them up and move them. If you can't get an ambulance, get some friends to pick the patient up.
Okay.
With no pressure on the injured extremity, and hopefully there's a pickup truck handy, lay them in the bed of the truck and drive slowly over the bumps to the hospital.
Okay.
That's a good, safe way, again, to transport a patient that's injured and expedite their care.
Okay. Very good. And you said keep the humerus like with a sling or something.
Right.
Keep
Just
it.
again, just fold it right over their chest, and they
Okay.
can hold it there with their other hand.
Okay. And that's for the arm up here at the top.
Correct.
Okay. What about, you said shoulder? How do you know whether somebody has a broken shoulder? Isn't that the bone back here in the back?
Yeah, actually, it would be more up in the ball part of the shoulder. The scapula in the back is kind of tough to get. It's surrounded by heavy muscle. We see a few fractured scapulas, but that's usually that when they fall on something sharp, like a stump.
Okay.
Or something that really nails them hard.
Okay.
But the upper arm, again, it'll be pain, inability to move, hold it still, and then get them to help.
Okay. So the actual shoulder blade in the back is a rather hard bone to break.
Yes, it is.
Okay. What about whenever the bone goes through the skin with a compound fracture?
Yes.
Is that correct?
It's called a compound fracture. When the bone goes through the skin, you've got to splint it, ideally where it is. If it's going to be a while before you get to help,
Okay.
you have to keep the bone moist. And then it's up to the doctor in the hospital to clean up the wound.
Okay.
If you pull the arm or leg and the bone goes back under the skin, be sure and tell the hospital that.
Okay.
Because whoever's treating it, once it's compound, is going to open it up, wash it out good, because those are always contaminated wounds.
Okay. So
At best.
you say open up as in surgery?
Surgery, yes, you go to the operating room for that.
Okay. So if they have a compound fracture, and then chances are that they're going to have to operate, lay the.
Yeah, you open up the fracture completely, wash it out thoroughly,
Okay.
and then if you need some type of stabilization device, whether it be a rod or a plate or a screw, whatever it takes to stabilize the fracture so it can heal in good position.
Okay.
And then you sew the wound shut and antibiotics and let it heal.
What about, you mentioned keeping the bone moist. What happens if they don't do that?
Dry bone dies.
It does.
Yes. Now, bone has its own blood supply, but it's a limited supply.
Okay.
So if it's, but usually nowadays we're not that far from help unless you're in a remote area. If you are in a remote area, it's just going to be tough. Best, I guess, is just to do the best you can and expedite the speed in getting the injured person to a facility.
So if they have you're on a hiking or camping trip, somebody falls and their leg goes through their skin or their arm goes through the skin, would it be okay to take something like a bandana or a t-shirt and put it in water or pour water out of a canteen on it, then put that on the bone to keep it moist?
Yeah, you want to cover the wound with whatever you have.
Okay.
Not everybody has a sterile pack ready, so you just cover it with what you have. It can be a bandana, it can be a shirt, and then get them to help as soon as you can and notify people you're coming.
Okay.
Pure judgment call. What's the easiest way to transport the patient?
Okay.
If it's a leg, if you have a four-wheeler, it's an arm. If you can get them to help, do whatever is safest and fastest.
About how long do they have before the bone starts to die?
Hours.
Hours. Okay, hours. Okay. Alrighty. And well, I think that's about it. Is there anything that you would like to
No,
talk
I
about?
think that's it. Just with our kids today, we've got to watch the young people on four-wheelers. Don't turn them loose.
Yes, sir.
I see a lot of 3, 4, and 5-year-old kids on adult four-wheelers that hit trees, park cars, and houses because they just don't understand the control of it.
Okay.
They love the speed,
Yes, sir.
but they don't have the dexterity to control it. And that, in my opinion, is just be safe.
Thank you, doctor.
Okay, thank you.